We like to think our doctors have all the info they need to keep us healthy, right? But what if I told you there's a huge, critical piece of data that's missing from pretty much every single medical record? It's a missing layer of intelligence that could change, well, everything. That missing piece? It's our environment. And today, we're going to dive into what that means. Now, seriously, just think about it for a second. What if your doctor knew exactly what you were breathing on your walk to work? Or the air quality at your kid's playground? We're talking street level, block by block precision. How different would their advice be? How much better could their treatments get? Because this isn't some small detail. Here's the staggering reality. The research is pretty clear that up to 70% of our health outcomes are determined by our environment. Not our genetics, not the hospital we go to, but the world around us. That is a massive, massive blind spot for medicine today. And that's exactly what this is, a doctor's blind spot. You know, modern medicine is incredible. It's so advanced. But right now, it's kind of like flying a state-of-the-art jet with only half the instruments working. And this really gets to the core of the issue. A doctor sees a patient, maybe their asthma is getting worse, but they don't know why. I mean, is it a sudden spike in PM 2.5? That's that nasty, tiny particle pollution in their neighborhood. Or maybe it's high levels of nitrogen dioxide from traffic near their office. Right now, that kind of data, it just doesn't exist inside the four walls of the clinic. Okay, so what if we could actually fix this? The wild part is the technology to solve this problem, it already exists. It's just a matter of connecting the pieces. And it comes from three totally different industry leaders. So let's meet the key players who are going to help us connect these dots. All right, first up, we've got what I'd call the brain of the whole operation. Epic Systems. Now, if you've been to a hospital in the United States, there is a very good chance your medical records live inside Epic software. It's basically the central nervous system for American healthcare. And Epic's dominance is, well, it's huge. This isn't just some database, it's the operating system for hospitals. We're talking records for over 42% of the market. But here's the key part. It's the screen, the interface that doctors are looking at all day, every day. And that makes it the absolute perfect place to deliver these new environmental insights. Okay, so we have the brain. Next, we need a map maker. And that's where Esri comes in. They are the global standard for what's called Geographic Information Systems, or GIS. Basically, they are the world's experts at understanding the where of, well, everything. And that includes our health. So what Esri's tech does is pretty amazing. It takes all this raw data and turns it into smart, intelligent maps. It can show you exactly where pollution hotspots are, or which neighborhoods might have higher health risks. It can even create something called an environmental digital twin, which is basically a virtual copy of the real-world environmental health. Super cool stuff. But, you know, a map is pretty useless if you don't have any data to put on it, right? And that's where our third and final player comes in, Sparrow Analytics. These are the folks providing the revolutionary, high-definition environmental data that honestly has been missing all this time. And check this out. This is how they actually do it. This little device right here is called the Sparrow node. They mount these things on fleets of vehicles. Think postal vans, delivery trucks, that kind of thing. And as these trucks are just driving their normal everyday routes, these sensors are constantly sampling the air quality. We're talking block by block, second by second. Now, the critical thing to understand here is the precision. This is not some single citywide average from a government sensor sitting on a roof miles away. No. This is real-time, address-level data for over 25 different pollutants. And it's all delivered through a simple API, which is just a secure way to move data around. This is what finally makes the data good enough or clean enough to be used in a clinical setting. Okay, so let's recap. We have the brain, that's Epic. We have the mapmaker, Esri. And we have the sensor, Sparrow. So how do these three powerhouses connect to build one seamless system that actually gets this vital information to the doctor right when they need it? Well, the magic that ties all of this together is a modern data standard called FHIR. That's spelled FHIR. The easiest way to think about it is like a universal translator for healthcare data. The Epic on FHIR platform is what allows trusted external data, like this environmental intelligence, to be sent securely directly into a patient's medical chart. So here's how it all happens in 5 super quick steps. Step 1, a doctor opens a patient's chart in Epic. That's the trigger. Step 2, behind the scenes, the patient's home address is automatically sent to Esri. Step 3,
Esri instantly asks Sparrow for the environmental data for that exact location. Step 4, Esri's system crunches the numbers and calculates a risk score. And finally, Step 5. That simple, easy-to-understand insight is sent right back to Epic and pops up as a little alert for the doctor. The whole thing happens in just a few seconds.
Okay, so that's the techie part. That's how it works. But what does this actually mean for a real person, for a patient? To see that, let's take a look at a story. We'll call him Leo, to see this new way of practicing medicine in action. And this really shows the huge difference between the old way and the new way. The old way is totally reactive, right? A doctor asks, so have you been coughing more? And they treat the symptoms after an asthma attack has already happened. The new way is completely proactive. It uses objective, real data to figure out the environmental cause and hopefully prevent the attack from ever happening in the first place. So imagine Leo is 7 years old. He's got asthma, and he keeps ending up in the emergency room. Now, when his doctor opens his chart, this new little widget appears called Environmental Vital Signs. And boom, it shows elevated particulate matter at his home address. But here's the kicker. It shows high levels of nitrogen dioxide, that's a major traffic pollutant, right near his school, with a big spike right during his morning commute. And then the doctor sees this alert. This right here, this is the real game changer. Because it's not just a bunch of numbers, it's an actual clinical recommendation. For the very first time, the doctor can see the invisible trigger that's been causing the problem. They realize, oh, wow, Leo walks to school right along a busy freight corridor every single morning. And the result? It's incredible. The doctor and Leo's mom use this data to map out a clean air route to school. It's just 1 block over, but it has 40% less pollution. And the outcome? In the next 6 months, Leo had 0 ED visits. 0. A simple change in information led to a completely life-changing outcome. Now, Leo's story is really powerful, but honestly, this is just the beginning. Let's zoom out for a second and think about the future of healthcare when this kind of intelligence isn't just for one patient, but for entire populations. The applications here are just immense. I mean, you could warn a patient with heart failure to stay inside on a high ozone day to stop them from being readmitted to the hospital. You could track a pregnant patient's total environmental load to help protect against preterm birth. A whole hospital system could use this data to find pollution traps in their city and push for policy changes. Or they could predict ER surges from things like wildfire smoke and make sure they have enough staff on hand. It's a total paradigm shift. Which really brings us to the final thought here. For so long, medicine has looked at the patient almost in a vacuum, isolated from their world. That era is coming to an end. So I'll just leave you with this question to think about. What more could your doctor do? What could medicine as a whole truly achieve if it could finally see your whole world